Hello and welcome to New Start at Home. We're glad you've joined us today, and we're also glad that Dr. Doug Plata is with us. He is an urgent care specialist and trained in family medicine and preventive medicine, which means you're just very practical.
Thank you. I hope so.
And you probably see a lot of people that are just kind of anxious about things, and there's nothing that causes more anxiousness than maybe a foreign body in the eye or in the nose. We're going to talk about foreign bodies in the nose and the ears.
Right. Very interesting. Some of the most interesting cases I've seen. I'm sure you've seen them too.
So, you always hear the stories about a kid putting maybe a bean in his nose or whatever. What are the things you see?
Raisins, peanuts. I don't know why kids just do it. What can you do? It's gonna happen.
And then who is more troubled about it? Is the child or is the mother or the parent?
By far and away, it's the parent who comes in. Yeah, very distraught.
Yeah. So probably at first you're kind of like a psychologist saying it's going to be okay.
Exactly.
And you kind of do a little soothing. But let's get to that. What should we start with, the nose or the ears?
Honestly, I consider them about the same.
So let's start with the nose.
Okay, very well. Again, the most common things that I see are little children who don't know any better, and the parents will oftentimes say that they watch them, the kids just grab it and they just stick it in the nose. It's just something that they enjoy doing, I guess. And again, most commonly raisins, kids just love to do that, peanuts, these sorts of things.
So what do? They come in and they tried blowing the nose. What do you do?
Right, right. Oftentimes the mother's in a panic, and so she may have tried to get it out, she may not have. But regardless, in most cases it's fairly straightforward. We just have some forceps that we can go ahead and reach in and get it. It depends on how far back the kid has pushed, the foreign body, the object. We use different techniques. Sometimes sort of putting something past, getting behind it, and then pulling it out like that.
So is there anything they can do at home before they come to see you? What should they try before they get there?
What I find is oftentimes it's not too far in, and so they can go ahead and sort of just push it out. That oftentimes work. I would not recommend this next thing, but for them to do at home, because it's very dangerous. But sometimes we just take a Q-tip and put some, super glue on there, and we actually attach it on and then pull it out like that. But I definitely would not recommend. That's just asking for trouble if it's not being done by a professional.
That's true, because you end up with a Q-tip glued inside your nose.
I know.
Which would probably not be good.
Yeah, exactly.
Okay, so anything else about the nose before we move to the ear?
Let's move on to the ear, because there is something that I've seen that's common in the ear, and that is where people are sleeping, and it seems though they must be in a really deep sleep, because while they're sleeping, an insect actually crawls in the ear.
This is a common thing, like a cockroach or like a
yeah.
And so, of course, depending if it's a black widow spider, you're in deep trouble. But
fortunately, I haven't seen that yet.
Right. So what do you do in that particular case? What can they do at home? Anything?
Well, quite honestly, I find that people don't stay at home very long. Usually they are on the road and they're flying, because it's got to be one of the most disturbing things to have an insect crawling around in your ear. And oftentimes there's not, you try to get it out and the insect tries to stay in. It's trying to stay away from you. So it's very difficult to get out.
So if you shine a light, it freaks out.
Well, actually, sometimes they'll actually say, oh, that's the way out. And so they actually follow it. So yeah.
You can try that. That doesn't
Wouldn't
work. But usually, if it's not working, they come to you. What do you do then when they get there?
What I like to do is, first of all, I like to kill the poor insect, because it's just going to be a lot easier if it's not struggling to get out. So we can use alcohol and sort of kill it that way, or spray it, and then we...
It's rubbing alcohol?
Yeah.
So they could do that at home?
That's really true. They could do that at home.
Okay.
And it should be perfectly safe. And then we go in with sort of a needle nose, little clamps, and reach in and grab it, and sometimes it comes out in parts.
Okay.
It's the reality, yeah. But
but you might be able to do one other technique I've seen is use a little syringe and just like wash it out.
Sort of what? Yeah, that can work as well.
Could they try that at home?
If they have that, if they've got a syringe,
like maybe a bulb syringe or something.
Yeah.
Just use
yeah.
something. We've been talking to Dr. Doug Plata. We're talking about foreign bodies in the ears. Very practical information for those of you now. I think there's all kinds of information like this, and you can access it here on our website at newstartclub.com. That's newstartclub.com. Thank you, Dr. Plata. This is very practical. It might seem like a small thing to you, but a small thing in the ear is a big thing, isn't it?
That's right.
So we're glad that you've joined us here at New Start at Home, and thank you also again for being with us.